All right, everyone, welcome back. We're going to continue with our second day of this fifth annual Daoist Conference. Our next presenter is a researcher of premodern Chinese medicine and bodily practices. An accomplished academic, she has first class degree in religious studies from the University of Wales, PhD from University College London on the therapeutic exercise in the Sui dynasty of China, postdoc at Academia. I'm not sure which language I'm supposed to pronounce this in.
Academia Sinica.
Maybe. If it's in Spanish. She now is a freelance researcher, editor, and translator, and has co-edited Asian Medicine and the Routledge Handbook of Chinese Medicine. She teaches Tai Chi and qigong and facilitates an online practice group on the exercises she wrote about in her recent book, relatively recent book, Exercise Prescription in Sui China. Her next book will be on horse medicine in pre-modern China. Honestly, her writings and papers are an incredibly resource for anyone who wants to look back on pre-modern therapeutic exercise, whether they want to practice them or know where they come from. I know some of the facts that she pulls out and some of even the papers that you can find online as well make you rethink the past and history and the way some of these bodily traditions moved around the world. For example, I forget the exact dates, but she referenced facts like the first illustrated descriptions of some exercises that now we associate almost entirely with yoga appeared on ancient Chinese manuscripts, hundreds of years before they were recorded in India, which is so fascinating because we know how much trade there was going on between those countries back when, but we don't always think about that in regards to bodily practices, do we? At least I didn't as much. She is kind of the authority on Chinese therapeutic exercises. Her book on the medieval therapeutic exercises compiled in the Juming Wenho Nun, where the doctors during that time were prescribing exercises alongside their herbal and acupuncture prescriptions for both external diseases like pain, but also for internal diseases as well. So I'm really excited to not only hear about these practices in history, but perhaps practice a little bit as well. Dr. Dolly Yang, please take us on a journey here.
Well, thank you so much. Can you hear me okay? Yeah, brilliant. Excellent. So I'm just going to share my screen now. So can you see my screen okay? Brilliant. Excellent. So first of all, I would like to express my heartfelt thanks to Master Zhou and Sam for their kind invitation for me to speak on a subject which is dear to my heart, medieval Chinese therapeutic exercises. My passion for this field began during my doctoral studies at University College London. I need to be able to move to the next. Sorry. Yeah. Okay. Which I completed in 2018, and it has only deepened since. Last year, I published a book entitled Exercise Prescription of Sui China. Sorry, I seems to have a bit problem with the my screen. So, okay. All right, let's carry on. So, which enabled me to expand on the practical elements of my PhD thesis. The book contains nearly 200 therapeutic exercises known as Daoist, preserved in the 7th century medical text entitled 诸病源候论, Treatise on the Origins and Symptoms of Medical Disorders, a remarkable treasure trove of medieval Daoist practice. It is this rich legacy of embodied self-cultivation for health and well-being that I'm honored to share with you today. There has always been a strong connection between Taoism and Chinese medicine, which is reflected in the theme of this conference, Taoism, Divination, and Healing Arts. Medical knowledge and practices are essential components within the Taoist traditions even to this day. Although Taoists were historically vital to the development of Chinese medicine, both traditions are rooted in the broader Yangshen, nourishing life culture, which has evolved and shaped over a long period of time by different groups of people, including Wu, spirits mediums, Xian, transcendence, 方士 masters of exoterica, physicians, literary elites, Daoists, and Buddhists to meet their various needs. Although constantly evolving, by the 4th century CE, Yangshen referred to a variety of self-cultivation practices, including breathing exercises, Daoing, diet, meditation, visualization, and sexual hygiene, and other preventative health practices. The formation of Chinese medicine as a recognized system, which took place between the Warring States, Qing, and Han periods, began largely independently of figures or communities we would identify as Daoist. The history of Daoing provides a powerful case study for this very point. While Daoing was undoubtedly adopted and adapted within Daoist traditions for religious and spiritual cultivation from roughly the 2nd century CE onwards, its origins had little to do with Daoism. Furthermore, its later systematic medical applications were largely driven by political ambitions during the Sui period. With this historical backdrop in mind, my talk today is divided into 3 parts. First, I will give an overview of the history of Daoing from the Warring States period, when the earliest extant sources related to Daoing were recorded, through the Sui dynasty, when Daoing became institutionalized as a key component of state medicine, thus roughly between 3rd century BCE and 7th century CE. Second, I will introduce the text 诸病源候论, the 7th century state-sponsored medical text, and to examine how Daoing exercises were incorporated into this text and how they were prescribed for specific diseases. Finally, I will guide you through a short practice of selected Daoing exercises from this medieval text. This will give us a direct, embodied understanding of these techniques and create a tangible basis for comparing and contrasting them with modern qigong forms that many of you may be familiar with, as well as considering the potential therapeutic applications for us in the 21st century. So I will aim to have 15 minutes on the brief history of Daoing, 15 minutes on the text 诸病源候论, 15 minutes for a guided practice of selected exercises from this text. And hopefully we will have 10-15 minutes for a Q&A. Great. So although its roots are older, the term Daoing and its associated culture can only be dated confidently from the Warring States period. The earliest recorded instance of the term Daoing appears in the Zhuangzi, named after the philosopher. It is associated with Pengzu, a legendary figure reputed to have lived for 800 years as a result of his Daoing practice. The act of exhaling and inhaling, breathing out the old and breathing in the new, hanging like a bear and stretching like a bird, are simply methods for achieving longevity. These are what the practitioners of Daoing, people who nourish their form and pursue longevity like Pengzu, are fond of. The writers of the Zhuangzi were in fact criticizing these Daoing practitioners, who seemed primarily to care about nourishing their physical being. For them, it was more important to nourish the spirit, which is Yang Shen, than to nourish the form, which is Yang Xing, the body. So where did Daoing come from? A number of modern scholars argue that the ritual dances performed by the Wu are the precursor of Daoing, particularly in their animal forms. The character Wu is often translated as shaman or spirit medium. 说文解字 China's earliest surviving dictionary, defines the Wu as the invocators and explains that women have the ability to serve the formless and use dances to invoke spirits to descend. 4 specific legendary Wu specialists depicted by Han and later writers as Xian, transcendents, were associated with the practice of Daoing: Pengzu, Songzi, Fengzi, and Wang Ziqiao. The earliest known textual evidence of a breathing technique associated with Daoing is an inscription on a jade block from the late Warring States period. This jade artifact is a 12-sided cylinder. Although it has only 36 characters, many remain difficult to decipher. Despite differing interpretations, most scholars agree that this inscription represents the earliest documented practice of deep breathing, a fundamental aspect of Daoing. The majority of Daoing-related texts from the late Warring States and early Han periods belong to the literature of the Fang Shi. The term, devised by Han writers, denotes a broad range of technical specialists emerging from the 3rd century BCE onward. The Shi Ji, records of the great grand historian, first uses the title Fang Shi, for individuals who arrived at the court of the first emperor of Qing, presenting techniques for achieving immortality and transcendence. These specialists in natural philosophy and occult knowledge attracted patronage from aristocrats and elites who possessed the necessary time and resources to pursue longevity and immortality. The Daoing tool, a drawing of 44 color illustrations of human figures performing physical exercises, is one of the most celebrated archaeological discoveries. Unearthed in 1973 at the Mawangdui Han tomb in southern China, it was one of the burial objects belonging to the son of a local lord who died in 168 BCE at around the age of 30. Another important Daoing text, Yin Shu, the Pulling Book, was discovered in 1983 at the Zhangjiashan burial site in Hubei province. Yin Shu is the earliest extant text that offers a comprehensive step-by-step guide to physical exercise tailored for the Han nobility. These manuscripts testify to the popularity of various bodily-oriented techniques among literate elites in the late Warring States and early imperial periods. A number of medical texts written during the Han period bear witness to the use of Daoing as one of the main therapeutic treatments. In this passage from the Huangdi Neijing, the Yellow Emperor asks his teacher, Qi Bo, that I have learned the knowledge of the 9 needles from you, but have read about various treatments myself. These treatments could be Daoing and moving qi, massage, moxibustion, hot packs, acupuncture, burning therapy, and decoction. Do you apply just one of them or all of them when you are treating somebody? Qi Bo answered, these various treatments are for various kinds of people, and you do not apply all of them to one person. In Su Wen, we also learned about the 5 regional origins of 5 types of therapies, including Daoing, which originates from the central region. The area in the central region is level but damp. It is where myriad things are created by heaven and earth. The people of this region eat mixed food and do not toil, so they often suffer from atrophy and reversal of qi, hot and cold diseases, which can best be cured by Daoing and massage. Daoing and massage thus have their origins in the central region. So as we can see that the early development of Daoing was participated and shaped by a diverse group of people, including the Wu, Xian, Fang Shi, the physicians, literate elites, operating largely outside what we would consider as Taoism. This, however, began to change towards the end of the Han Dynasty. As the Han collapsed in the 2nd century CE, new religious movements emerged, notably the Way of the Celestial Masters in Sichuan and the Way of Great Peace in the East. These groups integrated Daoing and breathing exercises into their rituals of confession and healing. One of the earliest Daoist texts, the Taiping Jing, Scripture on Great Peace, for instance, taught that disease arose from inherited transgressions. The cure involved both moral confession and practical methods like meditation, visualization, and various breathing exercises, thereby situating its healing methods within the established self-cultivation tradition of the Fang Shi. Over time, the term Fang Shi was gradually replaced by Dao Shi, masters of the Tao, as these practices were absorbed into organized Taoist schools. In particular, Daoing became an auxiliary and preparatory part of religious practice at the Shangqing school of the 4th and 5th century. The patriarchs of the Shangqing school were all experts in methods of abstaining from grains and in Daoing, 辟谷导引之法. On the other hand, the educated elite during the period of division between the 3rd and the 6th centuries also played a crucial role in preserving and transmitting medical knowledge and self-cultivation techniques, including Daoing. Their role became important following the 4th century invasions of northern China, which caused mass migrations southward. Uprooted and facing unfamiliar, often challenging environments, these northern immigrants had an urgent need for practical medical and health preservation knowledge. It was for this literate genteel milieu of displaced northern elites in the south that a significant body of Yangshen and Daoing-related literature was composed. A prime example is Zhang Zhan's Yangshen Yaoji, Essential Compendium on Nourishing Life, which has an entire chapter on Daoing. Following its introduction to China during the Eastern Han Dynasty, Buddhism gradually integrated into the indigenous cultural landscape. As a result, some Buddhists began to adopt and adapt local Yangshen self-cultivation techniques as part of their religious practice. The 5th and 6th centuries witnessed 2 significant proscription campaigns against Buddhism, which compelled numerous monks and nuns to flee their monasteries and seek refuge in mountainous regions. In these remote areas where sustenance was scarce, many Buddhists turned to abstaining from grains techniques for survival, a regimen that often incorporated breathing and Daoing exercises. Thus, during the period of division between the 3rd and the 6th century CE, medical knowledge and Yangshen practices were primarily transmitted and shaped by 2 groups of people, members of well-to-do families, including familial lineages of physicians, and mountain dwellers, i.e. Buddhists and Taoists. The development of Daoing reached its zenith during the Sui, the dynasty that unified China after nearly 4 centuries of political fragmentation. In particular, during the reign of Emperor Yang of the Sui dynasty, Daoing emerged as the dominant court medical treatment. A vast number of Anmo practitioners, i.e. experts in therapeutic exercise, were appointed during his reign. This period marked a significant turning point as Daoing underwent a process of formalization and standardization. Various bodily practices not previously categorized as Daoing were incorporated into an expanding repertoire brought together under the umbrella of Daoing within one of Sui's official medical texts, 诸病源后论. However, Yang Di's radical medical reform was cut short, and the Sui dynasty was overthrown shortly after his death in 618. During the Tang dynasty, the number of Daoing practitioners employed within the Imperial Medical Academy significantly diminished. By the time of the Song dynasty, Daoing was no longer part of orthodox medical training. Nevertheless, Daoing remained a widespread practice in subsequent centuries. With the advancement of printing technology, an increasing number of Daoing-related texts were printed with illustrations, making them even more accessible. Such texts proliferated during the Ming and Qing dynasties, fused with all kinds of Buddhist, Daoist, and martial arts practice. Daoing has continued to evolve into bodily practices such as Tai Chi and qigong. Most importantly, although none of the Tang and later Chinese rulers embraced Yang Di's radical reform, the legacy of his vision is embodied in 诸病源后论, a text fortuitously preserved in its entirety, allowing us to access its wisdom today. So, in 610 CE, a medical text was presented to Emperor Yang of the Sui dynasty. This text, entitled 诸病源后论, became the earliest known nosological text in China, nosology being the branch of medicine concerned with the naming and classification of diseases. The text is divided into 50 juan and describes a total of 1,739 disease manifestations, detailing their etiology and symptoms under 71 headings, the Bing disorders. Chao Yuanfang, the imperial physician of Emperor Yang, is often credited with being its author and editor. However, 2 other possible authors, Wu Jingxian and Wu Jing, are identified in historical bibliographies prior to the Song period. Although the text concentrates mainly on the description of diseases and gives very little information about drugs or other therapies, it does include quotations from various Yangshen texts, notably the Yangshen recipes, and the Yangshen recipes, the Daoing methods. The former offers lifestyle advice on diet, sleep, and personal hygiene. The later offers specific Daoing instructions for curing diseases. Compiled from the physician's perspective for medical professionals, the text details approximately 200 different therapeutic exercises, some of which appear more than once under different disease entries. This systematic inclusion gave Daoing a more formal and standardized approach, making it easier for doctors to teach and prescribe to their patients. 诸 Zhu Bingyuan Hou Lun is organized on two levels: the Bing, meaning disease, illness, or disorder, and the Hou, which can be translated as manifestations, signs, or symptoms of specific diseases. For example, the first disease is wind disease, 风病. The whole section is entitled Various Manifestations or Signs of Wind Disease. And there are 59 whole symptoms, including lateral withering caused by wind, spasm in the limbs and inability to bend or stretch caused by wind, an inability to move the body and limbs caused by wind, lopsidedness caused by wind, sensation loss caused by wind. At this level, diseases are described and classified according to their external manifestations. The wind disease category has the highest number of Daoist exercises in the whole of the disease categories. 65 out of 293 therapeutic exercises, that is including repetitions, appear in the wind disease category alone. The writing style is both lucid and formal in Zhu Bingyuan Hou Lun, as it might expected from an official medical text. The etiology of a particular illness is described, its symptoms, and often its pulse. Where there are instructions for Yangshen or Daoist exercises or both, a standard phrase appears at the end of the disease description. So here is an example of a disease symptoms. It's called symptoms of lopsidedness caused by wind. Lopsidedness caused by wind is when deviance is lodged on one side of the body. When the body is deficient on one side, the wind deviance takes advantage of this and causes injury. Hence, a lopsidedness caused by wind. The signs are an inability to feel pain or itchiness, being sluggish and lacking control, or having B, pain. The orthodox prescriptions for decoction, hot pack, needles, and stones are given elsewhere. The Yangshen supplementation and Daoist instructions are now attached below. The Yangshen recipes, the Daoist method says, stretch one arm out fully, palm facing up. The other hand holds your chin and pulls it out. Pause and hold the fully extended position for a while. Do this twice 7 times, to the left and to the right. Then keep your hand still while turning your head from side to side, reaching a fully extended position. Hold your chin tightly. Do this twice 7 times. This gets rid of tension, and stiffness in the neck, headwind, dizziness, B impediment in the throat, cold infixation in the shoulders, and lopsidedness caused by wind. Notice that the above quotation has already described the curative benefits of the exercise. The compilers of Zhu Bingyuan Hou Lun copied the exercises from the Yangshen recipes, the Daoist methods, and inserted them into different disease categories. In the case of this particular exercise, we find it applied to the following diseases: symptoms of head spin caused by wind, symptoms of cold infixation, symptoms of throat beat impediment. So, unlike other Daoist-related texts, which tend to give instructions for the exercise before describing its curative benefits, this new classification of exercises, in accordance with the etiology and symptoms of a given conditions in this medical text presents a big step forward in the development of Daoist, greatly enhancing its accessibility for physicians and enabling them to identify the patient's illness before prescribing suitable exercises. Characteristics of many of the medical disorders described in this text do not translate easily into contemporary Western terms, as the conceptualizations of these illnesses are at variance within modern medical perspectives. Some are easily recognizable, for example, abdominal pain disorder, lumbar and back disorder, and urinary disorder. Others, such as sudden turmoil disorder, malignity, stroke disorder, or corpse disorder, are not readily comprehensible. When we examine the significance of Daoist exercise in this text, although only about 6% of the disease entries use Daoist as a treatment, nevertheless, Daoist instructions appear for over 2/3 of the disease categories, the Bing category. Also, it is notable that many Daoist instructions appear at the beginning of each category, and the first entry often bears the same name as the disorder category itself. For example, the first entry in the category of deficient exhaustion is symptoms of deficiency exhaustion, which gives a general introduction to the whole category of the disorder. 12 Daoist exercises are recommended for the condition described in this entry. The appearance of Daoist exercises in many of the introductory disease sections suggests they could potentially address all diseases in that particular category. There are 5 principal types of exercise in 朱炳元后论: physical movements, breathing exercises, self-massage, visualization, and incantation. These exercises are often combined. For example, physical movement is often combined with a particular kind of breathing, or is combined with self-massage, visualization, or incantation. There are also 5 main postures in which these Daoist exercises can be performed: standing, sitting, squatting, lying down, and kneeling. Some exercises clearly indicate which posture should be used, while others are less prescriptive. Interestingly, the Daoist exercises in 朱炳元后论 bear a striking resemblance to several postures found in the much later Hatha Yoga texts, including poses such as the foot behind the head, frog, shoulder pressing, butterfly, spinal twist, and boat. This affinity with modern posture yoga is accentuated by the text's own frequent use of the term 即是, literally extreme posture, or extending a position fully, much like in many Hatha Yoga poses. So, to connect with this text, we will now experience a short practice of Daoist exercises from 朱炳元后论, and I'm going to close my slides to help us focus on the exercise. So let's share, stop sharing. Okay, so I hope, so we're just going to spend, we still got, how much do we have? 20 minutes?
25, if you, yeah.
25, oh, great, excellent. Okay, good. Yeah. Okay, so just find a comfortable seated position, relax, and I will guide you through, starting with some maybe simple breathing exercises. So can you see me okay? Yeah? Okay, good. Because I can only see you, Sam. Right. Okay, so quieten your heart and calm your mind. Adjust and harmonize your qi and breath. Do not think about other things, but focus your intention and concentrate on the qi. Slowly and gradually spit out qi from your mouth and pull qi into your throat through your nose. You should do this gently and slowly. Do not hurry or use too much force. Wait until you are attuned and in harmony. While pulling and spitting out qi, do not allow the sound of incoming and outgoing to be heard. Every time you pull qi, concentrate your mind and heart and send the qi out through your toes. Pull in the qi over the course of 5 or 6 in-breaths. So that means you take the breath incrementally 5 or 6 times. So, and exhale once. And this is one breath. Count from 1 breath to 10 breaths. Gradually increase it to 100 breaths, then to 1,000 breaths. Your illness will be eliminated and you will be cured. So for us now, we're just going to take 3 breaths in this way. So continue with this kind of breathing. Now raise your toes. So when you inhale, you raise the toes. And exhale, relax the toes. And you do that with 5 breaths. So remember, when you inhale, you breathe incrementally 5 or 6 breaths and exhale once. So when you inhale, raise the toes. This exercise pulls speed impediments from your lumbars and back, gets rid of withering on one side of the body, and improves your hearing. Practice regularly so that your eyes, ears, and all the other senses are not obstructed. Okay, so next we're going to do some self-massage. So rub your hands together and massage, so make them nice and warm. And then you're going to massage your face and your eyes. So okay, so let's do that again. Rub your hands nice and warm. And then massage your face and your eyes. Next one, you're going to pinch the back of your neck with your fingers. So it's on the sides of the neck. So it's at the back. So you just do it up, down, just pinching the sides of the neck. So you do that a few times. Then you're going to pinch the size of your waist. Then you're going to rub your hands together. Again, make the hands nice and warm. And then you're going to massage the whole body. So you just brush, brush, and just brush everywhere with your hands. Brush everything downwards. The back as well. Okay, good. Right, so we're going to do another exercise. And this time, you're going to, so this one is that you're going to tuck your chin in and actually tuck your, so you need to roll your shoulder back and tuck your neck between your shoulder blades. And then raise your head, and then you're going to turn your head from side to side. So you just keep turning your head from side to side. And you do that 3 times, 7 times. So that is, you just keep turning 21 times. You probably could hear noise at the back, so the grinding noise when you're turning your head. Also, make sure that your shoulders are rolled back, because then you want to make sure this boarding points, the gallbladder 21 is pointing up towards the ceiling. So your shoulders are rolled back, your chin's tucked in, so you can then raise your head a little bit, and then you turn your heads from side to side. Good. Okay, next one. Firmly hold your cheeks with both hands tightly together. So hold your elbows tightly together and keep your lumbars firm too. And you hold like this for a while. So make your elbows hold very tightly together. Then move your elbows outwards. So it says disperse the qi from your elbows, shoulders, and lumbars, holding the position to its limit until you feel the sensation of compression beginning to increase. And you repeat the exercise 7 times. So we're just going to do it a few times. So when you feel this compression, then you go back to pressing the elbows together very, very tightly again. And you hold for a while. Then you can bring the elbows out. Feel this dispersing the qi from your elbows, shoulders, and lumbars. And you're trying to hold these positions to its limit. And when you're beginning to feel this kind of compression sensation, you can then bring them back again, the elbows joint tightly while holding your cheeks. So this exercise, it says, gets rid of exhaustions in the elbows and arms. Right, so the next one, hold your chest with both hands. Then shake your hands back and forth quickly and forcefully, as much as you can, twice 7 times, so 14 times. Once you've done that, without moving your hands, then you shake your elbows up and down thrice 7 times. So that's 21 times. It says this gets rid of exhaustion in the elbows and helps to disperse the heart qi downwards. Your blood is circulating throughout your body without obstruction and stagnation. Great. Okay, so we're going to try to do this one, which is in my slides earlier, and we kind of need to stand up. So this one, we basically you stretch out. I don't know if you can you see me okay like this? Okay, so you stretch out, one arm out with palm facing out, and then you're going to bring your hands, the other hands, holding the chin. And then you're going to pull the chin out to the other directions. And then you're going to come back again and you're going to let go and use bring the other arm out, palm facing up, and then you're going to pull this chin. The other hand is holding the chin now. Going to pull to the other side. So you just alternate. And this time, it also says, that's the second exercise related to this exercise, is while you're holding your chin, your hands not moving at all at this position, but your head is trying to move from right to left or left to right, while your hand is holding the chin. So the movement is almost, you can't really see the movement, but your head is trying to move to the right or to the left, while your hand is holding the chin. Then you can swap, change direction, and you can do the same on this side. Again, hold your chin quite tightly, and your hands not moving, but your head is trying to move to the left or to the right. But you will be met with the resistance of your hand. And try again on the other side. So first of all, you kind of pull the chin out as much as you can, and then your head trying to move. So it makes it even more extreme posture, if you like. Great. Okay. I hope that doesn't hurt your neck or anything. But after this exercise, you might find that your neck, you can turn your head much more loosely, more smoothly as well. So, okay, I think, there are lots of exercise in this seventh text. Previous exercise by spitting out qi. Okay, so should I answer the questions now? Or
Usually we'll get to the end for questions.
get to the end. Okay, yeah, I'm kind of
I'll read them
finishing.
off so you don't have to worry about the text box.
Okay, right. Okay, yeah. So yeah, I mean, this is just sort of a taste of the type of exercises that found in this 7th century medical text. So these exercises, they were all, they were being taught in the Imperial Medical Academy in the Sui court, also in the Tang court in the early Tang period, with the intention for the physicians to prescribe them to their patients. And it is actually my aspirations that I hope modern medical physicians of Chinese medicine can also receive this kind of training in medieval Daoist exercises or just Daoist exercises in general and integrate them into their treatment plans. So I hope you enjoy the sessions and thank you so much for your time and your participation. So yeah, we can move on to the question and answers time.
Thank you so much, Dolly. This is wonderful, and I think as a Chinese medicine practitioner, we can learn a lot from looking back at the past because we have an interesting view on physical therapy from this more pre-modern Chinese perspective. We have these yes, we have exercises like moving against a resistance is a slight isometric and
Yeah.
matches ENF style of stretching quite well. But just the completeness of some of these exercises that they were allowing or promoting doctors to use with their patients is a
Mm.
really wonderful thing, and it's not half baked. It's its own system in and of itself. So let's get to questions before I talk forever. Let's start from the beginning, and we have quite a few actually. What is the
Sure.
reason for prescription of abstaining from grains, the bugle practice in Taoist practice?
Yeah. So in the Taoist practice, I think the abstaining from grains is the practice of abstaining from grains is actually very ancient. So we already seen that in the Ma Wangdui text. So those techniques belong to the Feng Shi traditions, and they are the people who aspiring to become an immortal, yeah, to live forever. And so abstaining from grains definitely has got that kind of like longevity practice. So in a Taoist tradition, I think is also because it kind of inherited the as I said in my talk, inherited these Feng Shi traditions. So those Feng Shi techniques were incorporated into the Taoist practice, and I think they also wanted to curing their curing diseases, wanted to live, extend their lifespan, and yeah, I think also towards the fourth and fifth century, when there are the difficulties with that they all kind of have to lived in a mountainous place, and that's the time when that you definitely have to practice abstaining from grains because you just didn't have much food to eat basically. So if you're a hermit or living in a Taoist living in the mountains, you probably would have that kind of techniques to be able to survive. Yeah,
Yeah.
that's I think.
That's a really thorough answer. There are techniques in modern times why people might abstain, but from what you're saying, a
Yeah,
lot of it revolves around times where people were
yeah,
forced to the mountains and needed kind of a functional method of supplementing their life to actually live.
yeah, yeah,
Well,
yeah,
Agnesia is asking with the elbow exercise, which was asked during this
yeah.
exercise, what happens with the breath?
Yeah, so it doesn't tell you what happened. It doesn't give you the instructions with the breathing. So I think you just breathe normally. You don't need to hold your breath or anything. Because while you're doing this, I think you'll realize you kind of breathe quite slowly because you just can't, because you already concentrate so hard on trying to pull the chin. Is this the one or is it this one?
I think they're asking
Oh, yeah,
about
this one. Yeah. Again, I think none of these has got doesn't give you the breathing instructions. So I would just say, you just breathe normally.
sweet.
Mm.
Thank you. And for the one with the toe lifting, the breathing exercise at the beginning, Amy's asking, do you lift all the toes at once, or do you lift them incrementally with those 5 counts of the breath?
Right. So when I raise the toes, I just raise them all together like that, and then I relax them. I also trying to like just raise them while I'm taking the 5 breath, but then I realized that's quite hard. And I kind of feel that, especially in this text, there's a lot of exercises that you, after a while, you kind of beginning to understand that there's a lot of this idea of tension, relax, tension, relax. So there's a tension and relaxation, tension and relaxation. So then I think that makes sense. You just inhale while you're holding, so holding the breath while you're raising the toes, and then you exhale, relax the toes, and you do that 5 times. And in 诸病源候论, the breathing technique is this 5, breathe incrementally 5 or 6 in breath and then exhale once. that is one of the techniques that you could use.
Yeah, no, that's a good explanation. And I think it's really interesting the parallels between modern kind of, again, therapy where we have this like agonist antagonist contraction. So we're raising the elbows, for example, here and there, we're pressing together, and that's
Yeah,
to relax the
that's right.
opposite, the opposing muscle in a way that
Yeah.
wouldn't normally happen. And obviously, these doctors were very aware
Mm.
of what was happening there.
Yeah. And it's interestingly a lot of so these exercise, the one that we're doing here, and the shaking really hard up and down, those are from the this disease category of deficiency exhaustions. Yeah. So the 虚劳. And then it's kind of like almost counterintuitive. You think that, well, somebody's already so depleted, so tired and weak. How could they do these kind of very energetic like exercises? But then you kind of feel like, oh, beginning to understand why there are all these very energetic exercises in the 虚劳 categories. And that is, you realize they're trying to generate the heat. So it does makes you feel quite warm. You kind of sweat, and it helps the body to really kind of enliven again, so you get rid of the cold. There's the cold in fixations, there's a cold, on the shoulders and the knees, cold knees, and yeah. So it's basically, I think the idea is all those kind of exercises are trying to generate the heat. And so even though people who are quite weak or exhausted, it's better, instead of telling them to rest, rest, and rest, actually it's better tell them to move, move, and move.
Yeah. Yeah. No, there needs to be, I mean, within reason, obviously, you don't
Yeah,
do
sure, of course. Don't force them too hard.
fever. But yeah, no, totally. If you don't have that little spark, then how is it gonna happen? And the way you're talking about some of these exercises, kind of creating heat to remove some of that cold. And sometimes with
Yeah.
deficiency in Chinese medicine, we often look at most deficient patterns have an element of cold, even if it's
Mm.
by some empty heat or something like that. We have these different concepts, but we have this kind of emptiness of like where there's emptiness, there's not warmth, because qi is ultimately more of a yang force. It's more of a warming, enlivening sort of force. These exercises, we're kind of stoking that fire. This reminds me a lot of the winter qigongs that Zhou Shifu that you kind of teach, where it's a lot of those exercises are building with a specific respiration technique. In the low back, it's building a bunch of heat around
Yeah.
the lower spine. And
Right.
of course, you would do that in the winter on a mountain where you have a ton of wind and cold and everything like that.
Yeah.
If
Yeah.
somebody's obviously suffering, they're not on a hotel. They're, in a
Right.
more humble dwelling when these things were invented. So
Mhm.
we have plenty of questions to keep going with if you have the
I
time.
could see one. Could you clarify what you meant in the previous exercise by spitting out qi? So spitting out is basically my literal translation of this Chinese term, which is 吐气. So 吐 is literally spitting out qi. So I think the idea is you basically breathe out through your mouth. So you breathe in through your nose and you breathe out. So 吐气, 吐 would give you this clue that it is to do with the mouth. Yeah, 吐 it has got a mouth radical. So 吐气 will be spit out with your mouth, the exhale with the mouth. So that's spitting out qi. I basically translate it very literally.
No, that makes sense. We're gonna take the last two. I think, yeah, we have time for two more questions here. So could you
So,
explain what you mean by embryonic eating? Is that something?
oh, the embryonic eating is the is the one that you actually, you do the clacking teeth, and then you generate the saliva, and then you sort of massage inside your mouth, with your tongue, move around, massage your teeth. Then you swallow the saliva. It's the saliva that you're swallowing. That is the embryonic eating. Mm.
Sweet. Yeah.
So that's why the Taoists, they keep practicing this sort of stirring is that the red dragons, and then divided the saliva in three parts and swallow the saliva. So that's what they're doing. So yeah, you basically don't need to eat. You just need to take the ingest the qi. So that is the ingesting the qi, and then also creating a lot of saliva in your body, and then yeah.
Yeah, totally. No, it's something that comes up on and throughout a lot of practices. But yeah, no, that's yeah, perhaps a part of Beagle as well.
Yeah.
So we have a couple. Yeah, we'll go with the questions if you have the time, Dolly, because
Sure. Okay. So there's the parallel between the Ji Shi and Hatha Yoga asanas are intriguing. Do we see similar patterns regarding pranayama technique? So can somebody tell me what pranayama is? Something to do with the breathing techniques, isn't it?
yeah, I'll wait for them to respond, but I do believe it's mostly around breathing techniques. Yes, is the answer.
Yeah. So I think it is. But then when we talk about the breathing techniques, then it's kind of hard to know whether the Indians, because the Indians' pranayama techniques is kind of quite ancient. So they already have a lot of sort of breathing techniques in India. And therefore, my focus, particularly the article that I published, is more about this sort of physical postural technique. Because in the Yoga Sutra, they have plenty of these kind of breathing techniques. And but then they don't move. Yeah, they don't move out of, they maybe move the head a little bit or straighten the spine a little bit, but they never move away, move anywhere. But then only when after, so the 12th century, 13th century, when they have the so-called Hatha Yoga um, manuscripts started to emerged, then you realize the practitioners start to move. They start to sort of, do some kind of breathing exercise as well as moving the body, one leg tuck in much closer to themselves. And, they do all kinds, then they start to move. But that's only from Hatha Yoga. But the pranayama, I think that in the Chinese text, yeah, I would say they're again they're very similar. They're very similar, but you don't know who is influenced who. That's the diff. Yeah, we don't know.
Yeah,
Have
there
I
will.
answered?
We don't know, but eventually they all influence each other at certain
They
points.
kind of influence each other. Yeah. Yeah, that's right. So yeah, I mean the holding the breath, is very classic ones. In the Hatha Yoga, the holding the breath, at the end, almost you're not breathing. And you just keep training yourself to be able to reach the state that you don't really, you just hold the breath for a very long time. And that's also in the sort of abstaining from part of the abstaining from grains practices.
Yeah,
So yeah, they're very, very similar.
thank you. Could you please share a case in which you treated a patient?
Um, I haven't
Are
though,
you a
because
practitioner?
I'm not really a practitioner of Chinese medicine, although I'm actually really would love to now want to learn more because I'm essentially a historian of Chinese medicine. So that's my sort of my training, if you like. And but I do have this online class where we basically work through the exercises from the 7th century medical text based on the translation that I did, which is published in this book. And so we meet every other Saturday, fortnightly. And a lot of those participants, they are Chinese physicians, living in America or Canada or Europe. And so they have got people who they treat that they said, then they have got some interesting anecdotes about the exercise that they taught their patients, which I thought is very interesting.
Yeah, of course. And I've even, read through your book. So I know that some of the exercises are completely things that from a lens of traditional Chinese medicine. Also, some of the postures are so similar to yoga postures that
Yeah.
you talk to a yoga therapist, they would have a similar
Mm,
impression of a couple of
mm,
them. Um, and I would say that certainly like some of the things in the book are already things that we're giving to patients for, I remember
yeah.
certain things for back pain to remove kind of like B or painful obstruction. It's like, oh, yeah, we're strengthening the lumbar spine. We're doing breathing techniques to kind of massage the area. We might be massaging with our hands as well, and we're kind
Yeah.
of guiding, pulling kind of a traditional
Mm,
Daoyin
mm, mm.
perspective.
Yeah.
And so absolutely, the stuff works. I don't have a solely from the book
Mm.
what do you call it, case study. But at
Right.
the same time, these exercises absolutely are an excellent adjunct to a treatment plan. And even on
Yeah.
their own, you could kind of pull out and say, oh, like my back hurts or my knee hurts or my elbow
Mm.
hurts, and try out some of the exercises and gain some great insight. And that's the interesting thing about, what you're doing is being able to just kind of translate
Mm.
this into language that people can understand with some
Yeah.
illustrations as well. And yeah, it's it's really
And
good.
I think it is very exciting because, the more people do these exercises, the more people will be able to tell us whether they have got any therapeutic benefits or not. I mean, these exercises, they're very specific, and the more we do them in our online sessions, we just realize, they are really specific. They are to do with particular illness, and we just need to practice them and see whether they do have those kind of curative in ourself, in our body or not. And I think, yeah, I think it is I feel that they definitely work, and they definitely have got a really beneficial applications to be part of the treatments for physicians to be given to patients, and I think that will be so beneficial.
Yeah, and one thing that I love about some of the exercise in the book, and we're running out of time, so we'll finish
Yeah,
up.
sorry about that.
But no, it's great. One kind of a couple little notes is one, I think that I like these exercises because they often have a sense of contraction as well as focus on strictly relaxation, because I think for modern people it can be very difficult to access relaxation first because many people don't have the necessary physical activity that our ancestors probably did from just daily living to
Mm,
access the feeling of going from tight to relaxed, because many of them don't have the muscle tone to be able to do that. And I think that's one of the reasons why, for example, modern qigong or a lot of these more modernized Daoyin systems take so much from martial arts training, is because we need to be sufficiently strong. And I think
yeah,
in order to even release, even with tense muscles, we often need to repattern and just kind of use our body more as a society.
yeah,
I think these exercises, generally
yeah.
speaking, have a
Mhm.
concept of contraction and relaxation. They're not taking for granted that the
Yeah.
person is strong enough in these areas. They're adding some tone.
Mm,
When we talk about acupuncture, tonification,
yes,
dispersion, they're adding some
that's right.
tonification, they're adding some dispersion, and that way they're kind of
Mhm.
more
Whereas,
universally applicable than some other things that might be just soft or hard.
yes, so whereas in Taoing, basically you work directly to your body. So whatever the problem has, you basically through the movements or through the breathing, you then trying to unblock the qi rather than using herbal remedies or acupuncture. So you don't need any substances. You just need to work directly to your body, and it will just do it. So it's in a way it's more direct, and it's more come from yourself as well. And yeah, so
Yeah, and it's empowering. That's
it's very empowering.
empowering. You can
Yeah,
do it at home.
that's
So
right.
think yeah, references in the work like you're doing, Dolly, is really, really welcome addition to our traditional Chinese medicine.
Great. Well, thank you so much. Have I answered all the questions? I think
I believe we've gotten to all the
one of
questions.
the
We have
best. But yeah.
some notes on
All right. There's quite a
uh
lot of notes.
exactly.
But anybody wants
People
Yeah,
found it
anybody wants to
as
talk, I
well.
mean, you're very welcome to message me, email me, So yeah, thank you so much, everyone.
Perfect. Thank you for being here.
Welcome.
I'm gonna stop the recording.